by Vodafone Africa. This will be the 17th installment of the Metadata for Machines workshop. My name is Charles Kahiro and I am the Creative Director at WAT CET Africa. Now, for today's session, we'll be engaging with the Ethiopia team from Mekelle University and Addis Ababa University. They will be making some presentations, one being on their COVID journey so far, and the second one being on the installation of Vodafone in a box, which, as we know, is a grand step. So for today's session, will be led, or at least we'll start with Dr. Wondimu, and then we will play a recording of Dr. Getu's session. Since he has some internet challenges where he's located, they have been very heavy rain, so it might be intermittent. So we decided he does a recording, which we are going to play for all of you, and then we can have a discussion maybe afterwards in terms of the insights. But first, we're going to start off with Dr. Wondimu. He's going to do his presentation, and then we can go into a Q&A session, and then a short one, and then we can play the recording from Dr. Getu as well afterwards, and then we can have a final Q&A session at the end. As usual, during the presentation, let's try and have our mics muted so we don't have any background noises disrupting the flow. So if you are yet to do so, please do so now. And if you have any questions, just feel free to type them in the chat box and I can bring them up during the presentation. Yeah, I guess with that, I will hand over to Dr. Wondimu. Welcome, Wondimu.
Thank you, Charles. Okay, can I share my slide or, okay, let me share the slide. Okay, does it work?
Yes, we can see it.
Okay, thank you. First of all, I would like to thank all colleagues, Professor Francisca, Charles, Professor Miriam, and Mariam, Getu, and my colleague Tigist, Ephraim, and Desta for their great contribution. Really, we are very happy to join, just to get this opportunity, because this is a great platform in order to share, experience from different countries and also to apply the experience based on the country context. So I will try to present just existing situation in Ethiopia regarding to COVID response. So my presentation outline is like this, and then just this is a map of Ethiopia. We are, I think, the second largest country in Africa, about 115 million population, which is above 3/4 of the population is young. So just saying this, just to give you background information about COVID response in Ethiopia, Ministry of Health, Ethiopian Public Health Institute, in collaboration with different partners, they have been working intensively in order to prevent the rapid spread of COVID-19 in the country, because the first case of COVID case was detected in March 13, and then immediately after the first case is identified, officially confirmed, the government of Ethiopia declared a state of emergency, and there are different task force were established and actively working in different public health measures, including case identification, isolation, and also providing available treatment for the severe cases. So laboratory diagnostic capacity has been expanded in national and subnational, including now private laboratory also working on testing COVID cases. Currently, we have around 15 functional laboratory sites, which the capacity of testing is increased around 16,000 per day. So when the number of testing capacity is increased, the number of positive cases is also increasing. So besides this, as I've mentioned, different task forces established, including the national and international, Ethiopian diaspora also supporting in different area regarding to generating evidence and providing update information in order to contain the virus. So just to mention some cases, for example, Black Lion Hospital is one of the largest hospital in the country. It's about 600,000 outpatient per year visited the hospital. So in the hospital, there are different teams like case team, infection prevention and control, surveillance, scientific, logistic, and other several working or advisory teams were established. Even I myself is involving on the scientific, especially leading the modeling team. There are different teams which are working on this area. So just to mention some of the public measure which is being implemented, I think this is true for global and every country, given the lack of effective treatment and vaccine for COVID-19 prevention. The only option that we have is just taking public health measure like closing of schools and intensive awareness creation, restrict large gathering and movement of the people, and also promoting hand wash and social distancing, including mask utilization. Actually, strict mask utilization is implemented in Addis. Even we have, I will mention later. I will mention it later on. We have a 10-site observation. Then the evidence indicate that the practice is very good in regarding to respiratory hygiene management, especially mask utilization. And the major challenge is, adherence for social distancing is quite difficult. As you know, we are in developing country, so it's quite difficult to complete shut down the country because it doesn't work, because the economic issue is very serious, and then that might affect even more people than COVID-19. So what we are using is just adhering as much as possible for existing public health measure. So once I say this, already I've mentioned, we do have about 15 functional, and totally, I think yesterday we were able to test about 16,800 people per day. So the capacity is very increasing. As you see, the specimen collection source is different. Still, what we are doing is just testing people in the quarantine center, and also contact tracing, health facility, which is contribute the largest proportion, and airport 60%, isolation center 1%, community surveillance is also 19%, because even this month we initiated mask for Ethiopia, just adopting the WHO motto, mask for globe, in order to prevent COVID-19. So already in August, we are planning to test about 200,000 people for the COVID-19. So that might also increase the number of cases. So just to tell you the epidemiology of the cases, as you see, the number of cases is increasing. I think yesterday we were reported about 1,452 cases per day. So the number of cases is increasing. As I've mentioned, the number of positive cases are increasing in line with the number of tests performed. So as a number of testing and target groups such as contact testing increase, the number of positive cases is increased. But here we need also to give a focus for high risk group. When you are focusing on the high risk group, then it's very important to contain the rapid spread of the virus. Besides this, we have been, by the way, revising the guideline at different time. At the beginning, all cases were isolating, then the quarantine was intensively working, but nowadays the guideline for COVID-19 is revised, and then it's possible to self-isolation, non-symptomatic case, but severe cases and other is still it can be enrolled to the health facility, because we have identified COVID and non-COVID health facility. But still the challenge is, the capacity is still challenging us. So far the cumulative number of cases is around 31,000. So this is by far large. And the total number of cumulative days is also 544. The maximum days was observed about 26 per day, but the issue of days is, it includes, for example, sometimes we test also the body, someone when they died and then they test it. So that might be, affect or inflate the number of days because of this competing risk factor. For example, someone may be the cause of days might be other disease, but still when the test is positive, so we consider it as COVID-19 cause of days. So that might inflate the number of days. So as I've said, the cumulative number of days is, as you see the trend, it's 544 as to today. So the research output, I think I can say the first antibody test in Africa is done in Ethiopia. I was involved on part of that study. We have able to test about 85 individuals. So just we conduct comparative study. 84 individuals has, known contact history with COVID-19 case, and then 301 cases were no history of contact with known COVID-19 case. So finally, we found that about 75%, when we adjusted for sensitivity, and then the adjusted one is 8.5 prevalent. So this indicates that COVID-19 cases is even occurred in Ethiopia before officially confirmed, maybe before March 14. As you see, the IgM and IgG is 2.1. So there is no significant difference, by the way, for those known contact history and individual with contact history and without history. So this indicates that even we try to estimate the number of cases. I think in 95 confidence interval, we estimated that about 216,000 the lower, and then about 500,000 the upper in end of April. So this indicates that the cases is still in the community. But the good thing is 19% of the COVID-19 cases in Ethiopia is, asymptomatic. So without any symptom. That was one of the major challenge even to contain the disease, because people perceive that even sometimes they say that no COVID, just this is a politics. So this is one of the challenges. So the government is currently intensively working to prevent this, just to improve the awareness of the community. So this is also the observational study, which is conducted by our university. I was and TIGIST also involved in this research activity. We were able to observe about 1,300 individuals within a week. So far we have observed about 13,000 individuals in different, we identified, the most crowded area. So what we have seen is, if you look, the hand hygiene is, at the beginning it was good, but it seems, beginning it was good, by the way, after later on, then the maximum is no more than 35%. So still, we need to work hard, especially in improving the hand hygiene. So the second one is physical distancing. As I've said, it's one of the challenges. Still the physical distancing, for example, proper physical distancing is, the maximum is, in the first, in the mid of April, it's about 45. And then later on, it seems a constant. It's not as such high. It's not beyond 14. So the other is improper. So this is also need more attention. So we have to work more in order to create awareness. So this is also another challenge. And then the other one is respiratory hygiene. That was very nice, because strict mask utilization is already enforced in Addis. So as you see, we are around above 75% for last, hello. starting from June 10 up to now. It seems a constant, but still we are in good in this area. So using this data, by the way, we are trying to develop a model. For example, in order to convince a policymaker, we have to develop a model, how much the number of cases is reduced by implementing this already known non-pharmaceutical intervention. In this regard, as you see, the number of cases, there is a significant change. For example, the maximum, by the way, the first model that we have, I think we developed it at beginning of April. We estimated about 33.6 million people get infected at the worst scenario. And if we introduce more intervention, then I think that can be reduced to 15 million. But later on, when we use this data, the observational data, for example, if we achieve 85% of mask utilization by assuming 33% efficacy of the mask, so it's possible to reduce the number of cases, expected number of cases to 2 million. So as you see, in the worst scenario, without any intervention, if the current situation is continue, then we expect about 8 million cases of COVID-19 cases. And when we implement, for example, 25% of mask utilization, then it reduces to 6 million. And then if we implement 15%, then it's about 4 million. And then when we achieve 85% of mask utilization with efficacy of 33%, so it's possible the number of cases is reduced, but the picking time is, long. It may take around 1 year. So these two models for Addis and also for national. But still, the Addis one is just we use actual data because we do have observation data. So as you see, this is the figure. So 8 million in the worst case scenario. So this one in the right side is for social distancing. If we keep 40% of social distancing, so the maximum number of expected cases, about 685,000. If we adhere for 10% of social distancing, then the infection rate is reduced, and then we are able to reduce 2 million. So this is a combined effect of social distancing and face mask compliance. So if we are able to achieve, for example, 40%, then the maximum expected number of COVID-19 cases is 6 million. So the minimum, if we achieve the combined for both social distancing and face mask compliance, then the maximum expected number of cases is more than 200,000. But this might work for Addis, but it's quite difficult to ensure 40% of both mask and social distancing in the case of especially outside of Addis, because it's not easy. So the other information system, we do have, by the way, different information system. I can say that COVID-19 has also an opportunity, especially strengthening information system in the country. For instance, monitoring COVID-19 impact on firm and household in Ethiopia. This is done by in collaboration with World Bank. So this is phone survey. And the other one is household COVID-19 monitoring survey, and also hand sanitizer quality control. This is more electronic regulatory information system. For example, when the hand sanitizer is, because one of the challenges is the quality of hand sanitizer. So in order to control this, we develop in collaboration with Ministry of Health and GSI. This is used to control the quality, and also port entry health declaration. This is signed in PTM, age, and every personal information can be captured while individual enter to the country. So that information can be communicated with Ethiopian Public Health institution, for the further follow-up. And the other one is DHIS2, that is tracker. So this tracker is used for case surveillance and tracking. For example, in a case when positive case is detected, so the lab information system directly send information to the DHIS to tracker, then the surveillance officer, they can follow the status. And the other one is surveillance follow-up app. This is once for the positive case. Once the case is identified, then they develop a surveillance follow-up. They can give call and then they follow. And the other one is health facility reporting app. This is in any case, if the health facilities suspect any cases, then they can send information through this app. And also toll-free recording app. This app is just simply there are a call, then the individual can call about their status, and then the information that obtained from the individual can be also tracked by using this toll-free recording app. And also community house-to-house screen app. This is more work by health extension worker. I think 174 health extension worker is already started in Addis, this information system. I think it will be scale up to the rural part, because we do have more than 38,000 health extension workers. So they are the main source of, information, especially to improve awareness, to create community awareness. And the other one is electronic medical record. For example, in our hospital, if in a case, if they identify any positive case, then they directly link to iCare. We do have an iCare, electronic medical record system, and then the HMIS office can access the data from that. And also data analytics and visualization. This is more in DHIS2, which is implemented by Ministry of Health and Ethiopian Public Health Institute. So this is some of ongoing COVID-19 information system. So regarding the coordination and leadership, as I've said, there are different task force which is led by Prime Minister, and also this coordination is just done by Ministry of Health and other partner, for example, government agency, partner organization, UN agency, embassies, hospital, and others as platform. They meet weekly base, and morning briefing of information management system is being conducted daily by core staff and key partner representative, and also weekly virtual Zoom meeting is being conducted with technical working group. As I've said, there are different technical working group, and also weekly leadership and strategic virtual Zoom meeting chaired by His Excellency Minister of Health, Dr. Lia. And also support of financial, logistic, technical are being received from different partner, private institution, and individual and donor in order to support different quarantine center. And also, for example, one of the motto is stay at home. So if most of the people is, they live based on the daily income. If they stay for a long time, it's quite difficult to survive. So different organization is trying to support them. So this is the other platform. So this is also one of the risk communication and community engagement. They say it, Mikinat alone. I can say that I can't be a reason. And so this is more for young generation in order to protect the others. So daily press statement is being provided on COVID-19 situation on daily basis, and SMS, video, song, and so there are so many risk communication and community engagement platform is already being implemented and ongoing. Still, there is a challenge. The challenge is, as I've mentioned at the beginning, pure adherence to non-pharmaceutical intervention. As you see, the only good achievement is for face mask utilization, especially in Addis, but outside Addis, still it is low. Low consistency data collection technique. This is other challenge because different platforms use different data collection format, and incompleteness of data is one of the challenge, and low utilization of standardized recording and reporting format. Pure data quality and information use practice is still, because one of the aim of generating information is for action, but still it's not as such strong information use practice, especially to proactively respond for the cases. Increasing number of community days and late confirmation of COVID-19 by dead body surveillance and testing. This is also another challenge. Low stock out of PP. personal protective equipment is another challenge. There is also a critical shortage of bed COVID-19 patient as the number of cases is increasing due to the testing capacity is increasing. And still, I can say that a lack of intensive testing of high-risk area for COVID-19 is another challenge. So this is just a brief presentation of the current COVID-19 response in Ethiopia. So I use the motto from Mikniyat Alonim, that is, I should not be a cause. Thank you very much. If you have any question and comment, please welcome.
Thank you, Dr. Ondemu. Do we have any questions for him? Following the beautiful presentation on the realities of COVID-19 in Ethiopia and their progress so far, any questions?
Charles, this is Bert. Can I ask something?
Yes, by all means.
Please.
Yes, Dr. Wondemu, thank you very much. Very, very interesting. I thought on your slides that you, basically on your last slide, I thought that there were several ways of reporting, and could you discuss a little bit, because it looks like it is difficult to get all the data, and it's probably difficult because you have different forms and different formats. That most likely means that you are not working with the standard format of the World Health Organization. So could you elaborate a little bit on all these different formats and all these different forms that you are using in your country, and maybe give an idea in terms of how to align that, how to standardize that?
Okay, thank you very much. Actually, the recommended one is, the WHO standard format for the surveillance and also for detecting cases. But the problem is, as you see, we have a private and also different organization. So still the challenge is infrastructure. For example, if we want to capture the data from the lower level, as you see, most of the data come from the manually, the data entry is manual. So in this case, for example, in certain district, when they test the cases, then they use their own format, even though it's recommended to use a WHO standard. But now the government, what we are doing is we are introducing more DHIS2 tracker. So to link DHIS to DHIS2 tracker, because that one is almost 90% of health facilities currently reporting using DHIS2. So what we are promoting is just to use the standard WHO reporting format to link with DHIS2 tracker. But as I've said, the problem is, different organization, for example, private, when they test the cases, just simply they take only name and ID and also sex, but other variable might not be included. For instance, even in our hospital, all patients going to be admitted in the hospital should be tested for the cases. So the lab information system, they took name and ID and also patient ID and then sex, but other variable is not included. So that's the challenge, but still the government is working on this area. Thank you very much.
Yeah. Okay, thanks for your answer.
Oh, I have a question as well. So as part of your COVID-19 information systems, you have a community house-to-house screening up, but you also have a household COVID-19 monitoring survey. So are they picking the same data, or is it different?
Actually, the standard checklist is already developed by the national level. The problem is, Ethiopia is a very vast country. For example, we do have different geographical setting. Even though they pick only a few cases like sex and age and also travel history and symptom, some of the symptom. that one is not completed. But now the government is intensively working in capturing this information system. Maybe we will use also this platform. For example, now we are trying to use just to link the information system with fair data point. So if we introduce this one, and then I think we can overcome such a problem.
All right. I guess, yeah, thank you, Dr. Ondimu. I think we can move on to the presentation by Dr. Getu. The good thing, it's a recording, so we already have it. It's around 36 minutes long, so we won't go that much overboard the 1 hour mark, so do bear with us. But it's there on your screen already. So Ivy, take it away.
Hello, this is Getu from Ethiopia. In this session, I'm going to present the Vodan in a box installation for Ethiopia. In Ethiopia, we have two installation sites, Mekelle University and Addis Ababa University. From the last two webinars, we have learned the process, step-by-step process to install Vodan in a box. So since we have seen it in detail for the installation in Nigeria, so in this webinar, I'm not going to present the detailed installation process. However, I will go through the steps we have gone through briefly. So my presentation will be very short. Finally, after this presentation, I will show you some demonstration of the first installation. First start Vodan in a box for Addis Ababa University. So in our pre-installation, we have two sites, Mekelle University and Addis Ababa University. For both, we managed to create the domain names. Unfortunately, for Mekelle University, we couldn't use the domain name for the university. Rather, we bought a new domain name for this particular training, and we created 4 subdomains which point to same virtual server IP address. For Addis Ababa University, we were able to create 4 domain names in the root domain name of Addis Ababa University, au.edu.et. So we have 2 installations, as we all know, the local deployment and production deployment. So before we got the domain names, the subdomain names, in server space, we were trying to familiarize ourselves with the Vodan in a box by installing it in local machine. So we were able to install the Docker engine, Docker compose, and we cloned the Vodan in a box files from GitHub, and we installed it successfully. And we were able to access the CRF wizard, fair data points, and other tools. After we get the production deployment, so for the production deployment, we followed the same procedure as the local deployment. We installed the Docker engine, Docker compose, and other tools. which are required for the production deployment in the servers, in the virtual server. And we were able to configure the domains for each universities and secrets. We edit the configuration files, and we try to change the docker compose.yml. After we edited the configuration files, we obtained SSL certificates. We produced the certificates using the subdomains. And finally, the first start of the Vodan in a box for Mekelle University was successfully done. So the tools for Mekelle University is ready to be used. However, for the Addis Ababa University, we deliberately delayed that for this webinar to give demonstration in this session. So local deployment, these snapshots show the local deployment in our local machine. So the first snapshot is CRF wizard. You can see it was successfully installed, and in the CRF wizard, following the demonstrations given by Luz and his co-worker, we tried to create the CRF, and from the CRF we generated report. And as you can see, the fourth snapshot shows the fair data point. So we successfully created the FDP, the CRF wizard, and we managed to create CRFs, and we generated reports as well. Next, in the production deployment for Mekelle University case, after we get the subdomain names, the four subdomain names, we were able to install the DSW, FDP, and Sparker Allegro Graph repository. And as you can see, the first snapshot is the DSW mu.dhc.edu.hc. This is the CRF wizard. I changed the password to my credentials, G2 and get.mu@mu.edu.it, and the password as well. I also created the catalog, dataset, and distributions for the Mekelle University Tigray Regional Health Bureau Fair data points. Then the Allegro Graph repository. We have created the CRF repository, and it's ready to be used. One thing I forgot, we also edited the submission service between the FDP and DSW. So in case of Addis Ababa University, as I have explained it earlier, after we got the subdomains, we were able to install the Vodan in Africa, Vodan in a box. But we haven't finished it yet, so we delayed it for this presentation. I will show you the demonstration later. And this is this is the Allegro graph. We have no repository, so I will create one, and we will edit the anonymous user as well. So in Addis Ababa University, I will show you. In fact, I have changed the password. So as you can see it here, CEST CAT is the admin for the FDP, DSW, and the allegrograph. So in the demonstration, I will create repository CRF in the allegrograph. We will create and publish catalogs, the catalog dataset and distribution for Addis Ababa University, and we will update the submission service, and we will restart it, and we will check it out. Lessons learned so far: we have learned how to install FDP, CRF, and Sparkle, generally the WAT inbox. In addition to that, we have tried to understand the relationship among these three tools. That's what we have learned so far. And the challenge, as we all know, as Eric always mentioned, the training is like building the plane as we fly. So the training by its nature is very challenging because most of the things are new for us, so we have to understand them and we have to learn about them thoroughly to catch up with the training. And in addition to that, it's really a learning process for us. We have learned a lot of things, a lot of new technologies related to semantic technology, FDP, and generally FAIR principles. So thank you. Next, I will try to show you the demonstration part. So let's start from the first is, let's start the WAT. It's already running. It's already running. So let's begin with this www.au.edu.gt. So it's loading. So here we can change the password by going to the username text. If it is new, it will actually it has to start here. So this shows the login, and we can log in as this is the admin edu et. So text is admin, but if had it been new, it will give you Albert Einstein, and the password is password in lowercase. So you can edit the profile like this. So we have the profile here. So we can edit the profile, the email, the first name, the last name, affiliation, and we can also change the password. We can give new password and save it. That's how we are going to change the password. And the other is we have to create repository. We have to create repository CRF. So first we can log in as admin, password. So I can create CRF, a new repository. Okay. And I can create anonymous by clicking the add user. It's already created, so let's edit it. Let's edit the anonymous user. Let's give it a grant. Okay, since it's anonymous, only read. Catalog, we have to give it root, and repository, we have CRF. Then we click OK. Let's log out. Okay, you there. Login. Admin. Maybe let's do it again. Okay, add anonymous. Okay, let's edit it. Let's grant, read, root, and serif. Okay. Yeah, so it's the user anonymous will have grant to read and catalog and the repository CRF. Okay, done. Number 4, let's go to fdp.lu.edu. Sorry for the delay. Actually, internet and the electricity was very challenging here. So yeah, it's loading. So we will change the password. Actually, I have already changed the password, and text is the admin for the Addis Ababa University FDP. So simply let's go and create publish catalog, dataset, and distribution in the FDP, and we will connect the CRF wizard and FDP by editing the submission service in the command. So until this loads, let me open my virtual box because I can easily access the server using the operating system. Loading, sorry. So after we create the catalog dataset, we will restart the folder in a box. So now let's log into the FDP. So the admin is text. So once we log to the publish catalog, dataset, and distribution, representing the CRF data. So I have already prepared the distribution. First, let's edit the front page as we have done it in the scoping exercise. This is titled Addis Ababa University Fair Data Point, and I will have this description. And the publisher is here. Save it. It shouldn't take time. Oh, sorry, let's reload it. So this happens often. So you can reload or you can clear the cache. So now let's create the catalog. So let's reload it. Okay, we have the catalog. So our catalog is, the title is COVID-19 case report format, and I have description. The publisher is Addis Ababa University, version 1.0. So this is it for the time being. We have catalog, so we have to publish it. We have created it, and it's considered as a draft. So once we publish it, it will be published. Okay, let's reload it. Sorry, I think there is a problem in the connection. So let's reload it again. Yeah, it will work. So we have this draft and we have to publish it. Yeah, it's published. And then we will create the data sets. I have the data set here. The title. So title. I have the description here. Okay, publisher is Addis Ababa University, version 1.0. Okay, here we need to add theme. Okay, the theme are this CRF semantic model. Sorry, semantic model, and this WHO CRF document. That we can add keywords like COVID-19, CRF, and so on. You can do that. Okay. Then we save it. This will be the data set. So still it's a draft and we have to publish it. Okay, published. Now we have to create the distribution. So the distribution, I have the WHO case report form in a div, I have the title, and I have the description. Publisher is still Addis Ababa University, version is 1.0. So media type will be text, total format, size. That's okay. Yeah, it shouldn't take this much time. Okay, let's reload it. So this error, unable to save entity data, it is because either the internet connection or the cache. So yeah, it hasn't created the entity. So let's create it again. The title, the description, so the publisher, that is the university version is 1.0, license right, modified access, media type is text, total, that's it. I think it's, yeah. So once we created it, we have to publish it. Yeah, done. We have successfully created the distribution. So now I would like to go back to the data set. I think let me check it again. I think it's in the I think it should be in the first, yeah, institution, then institution country. So I want to edit the vote on fair data points. I have to add here the country and institution web page. So the institution is https au.edu.at and institution country is Ethiopia. So this is the semantic representation for Ethiopia, for the country Ethiopia. So once we save it, we will have institution country. So we will have institution country and institution web page. That's all. Let's check. Yeah, now let's go to the server, view in terminal, and we will edit the submission. So the submission has to be, submission service has to be linked to the distribution. So we have this distribution, so we'll copy this number, and let's go to my virtual machine. So I have VODAN here, so VIM distribution. So we have to do config YML. Config, sorry, config YML. So I will copy. First, I need to uncopy this and paste the number config UI. So paste, yes. Then we save it. Okay. Once we edit this, we change the submission, we have to restart the. So now we have to down the Docker compose. Docker compose down. Docker compose down and restart it again and verify the CRF. So it's to check if there is any Docker run in our server. So there is no Docker running, so I have to restart Docker compose RD. Then let's check our data points. Your data point, what's AA? And let's check the data AAU. And let's check Sparkle. Save that. If the VODAN in the box is running smoothly, I think it is working. Yeah, the CRF wizard is loading. The data point is also loading. Yeah, the graph is also loading. I think we have successfully configured everything. Yeah. So this is the CRF wizard. Oh yeah, the polygon graph. We have the CRF here. We have everything. And fair data point. Hurry up. I don't know why the fair data point takes some time to load. Let's wait for 10 seconds. Hopefully it will. the connection is very slow here. That's why it's taking some time. Let me check it in fdp.au. Oh yes, it works. Yes, yeah. We have everything: the metadata, country, institute, and everything successfully installed. Thank you very much.
All right. I think congratulations for the Ethiopia team for finally being able to box. It's great to see that Mariam's live sessions have gone a long way to supporting the country teams to understand how the process is done. And now I guess we are on to loading them up with the data to finally prove the concept. I don't know whether we still have any questions for the Ethiopia team. I don't know if Ondimu is still around.
I'm
In case
here.
you have any questions for Ondimu or...
Yeah, Tigist also with us. So Tigist also can say something about the process because she's the one who play crucial role to get, domain access from the university.
Yes, Tigis is also here. And about hello, welcome. We can hear you.
Hello.
Hello?
Okay. Hello. Hello.
Hi, are you there?
Yeah. Can you hear me?
I think it's better to leave a message in chat box.
Yeah, because your connection is a bit slow.
Yeah,
maybe you can
yeah.
type it in the chat box and then we can read it out for the participants. Meanwhile, I don't know whether we still have any questions for the presenters.
Charles, if I may come in.
Yeah.
In the interest of our time, we're already 16 minutes ahead of time. Maybe if there are questions, I think everyone is on the Slack channel or the WhatsApp channel, so they can put in their questions. So, but I would like us to wrap this up and thank everyone for their participation today, and especially thank Beth, who I suppose is still on vacation, but made it to be with us today. We're really happy to have you. And I'm also happy to report, Beth, that so far we have the Buddha in a box installed in Uganda at the Kampala International University. And in Nigeria, we have 2 installed with the Data Science Nigeria and the Ibrahim Badamasi Babangida University in Lapai, North Central Nigeria. These 2 actually, they have their COVID-19 data ready and they're getting ready. I'm sure Data Science Nigeria, I think, should have started the process of data inputs, and IDBUL should be on the way to that. And Tunisia initially started on the CEDA metadata, but now they have also installed the Buddha in a box and the DSW as well. They have a little issue with the reporting, which Eric is trying to connect to Kes and Luis to see how they can help. But so far, the FDP, Vodan in a Box for Tunisia, the University of Sousse, is ready and is installed and is up and running. And the interesting thing with Tunisia is we have a case now to actually compare the CEDA metadata and the DSW, because we have the installation done for both platforms in Tunisia. For Ethiopia, like we have just witnessed, we have the VIB installed for both Mekelle University and Addis Ababa University. And now that we have it up and running, we're going to be working around the clock to make sure that we get the data in and we can start thinking of running queries by the end of the summer. For Kenya, we actually had a meeting today, and we are trying to work around the administrative and political issues around the FDP, and the Tangaza University has come to our aid to provide a platform to install the FDP in Kenya. And with the success from Tangaza University College, we can now showcase this to other government agencies in Kenya. So I would like to thank you, Charles and Ivy, and every of the participants from our partner countries and the observers. I saw Esther from Germany, I think, Esther now from Germany, and the Special Assistant to the Vice Chancellor of Kampala International University, Malam Ibra, is here representing the VC. We'd like to thank everyone for your support so far. Miriam Basaja, I'm sure you'll be very happy and smiling now, because I mean, your team, the technical team, has grown so far that you can actually relax and then have the other people assist you with the installation of the FDPs, the Vodan in a Box across the countries. So thank you, everyone. I'm going to hand it back to you, Charles, so that you do your thing as usual. Thank you.
And there you have it. If you do have any questions for the presenters, just forward them anytime via WhatsApp or on Slack. I believe you're all members of those two channels. And we'd like to appreciate all the attendees for taking their time to be here with us. As always, a recorded version of this webinar will be available on the Vodan Africa website. In case you missed part of it or you'd like to review the topic again, just be sure to check them out. As well, be sure to join us next week for the 18th installment of the Metadata for Machines workshop. Details on the timings will be shared on the various comms channels, which is the Slack and WhatsApp groups. Congratulations to the Ethiopia team, and thanks again to everyone for joining us today, and we will see you next time.
Thank you very much. Thank you, Charles, and all for your attention.
You're welcome.
If Beth has anything, has some words to say to us. Beth, are you
Yes,
there?
Bert.
Yes, you know, I'm very happy with the progress. I can see that, you know, although sometimes it was a little bit hard to hear because of the sound, but I got the message. So I think the Ethiopian team did a very good job in getting this to work. Thanks very much for, let's say, also the demo and the presentation. So it gave a very good view. I will take this back also to the team with us, and you know, I look now forward actually to see that we get some real patient data into the systems. So either using the wizard or by any other means, that we start filling these fair data points with the right patient data, of course. Once we are there, then, you know, we could do the real exercise, which is to question them, to query these fair data points and have some true results out of the system. Of course, that would be fantastic if we can have that before the end of the summer. So I'll be dialing in at least next week again, and I hope that we get similar good progress. Thanks very much.
All right. I believe that's that. We have come to the end of the webinar. So we will see you next week. Be sure to check the comms channels as well as revisit the recordings for all the previous webinars if you need to learn more about the Vodan in a box.
Yeah. Thanks, Charles. Talk to you next week.
All right.
Bye.
Bye.
Thank you.
Bye.